Hello, I'm Russell Visser and I'm here from Northwest Physiotherapy Group with my colleague Graham Nelson, and we're here to talk to you about the 5 most common reasons for leg pain. The aim of this series of talks is to educate you about your musculoskeletal health, particularly relating to your legs, and how to prevent issues from arising in the future. Thank you. Graham?
Thank you, Russell. My name's Graham Nelson. I'm talking today about iliotibial band friction syndrome. Now, the iliotibial band is a band of connective tissue that starts from the top of the thigh here and goes down the side of the leg and inserts into the top of the tibia or leg bone. We can see it on this model here. The point of insertion would be just approximately around here, okay, on the outside of the knee. This is the right knee. So the purpose of the iliotibial band is to connect the muscles from the front of the thigh and the back of the thigh, so that's namely the quadriceps muscle and the hamstring muscles, connect them together and act as a stabiliser for the leg and the pelvis. So the iliotibial band friction syndrome is quite a common problem, particularly with weight-bearing sports such as running. So this is often felt on the side of the leg here, and it's often just opposite the kneecap. It's often worse after you've been doing some sports such as running, and it can be worse going uphill or downhill or upstairs or downstairs after you've done the aggravating activity. You can also feel a sense of tightness on the side of the leg, which may spread up to even the hip region. Okay, so how do you know you've got iliotibial band friction syndrome? Well, there's a few ways you can test it quite easily yourself, and one is just the area of where you're getting the pain or symptoms, which is just on the outside of the knee here. Sometimes you can also feel a tight band of tissue if you run your hand backwards and forwards just on the side of the knee. Another way to test for it is to actually straighten your leg when you're in standing, and if you do it fairly quickly and a few times like this, you may elicit some pain on the side of the leg. And as mentioned before, you often feel it going up or down stairs, particularly after you've done a run. And another way to simulate that type of movement is to just do a single leg squat and squat just halfway down or even a quarter of the way down and feel where the pain is. So how do you manage this condition if you know you've got it? Well, there's a couple of easy things you can do. The first being modify the activity that you think may have led to it. So if you've changed your routine in training, for example, if you added some hills into your training or you're doing some interval training, maybe just cut that back for a little while and see how the pain settles after that. So that's one thing you could do. So modify what you think may have led to it. If you're doing squats at the gym, for example, and you've just added them in, or you've increased the weights, or you've done some heavy leg exercises, cut them back, reduce the weight, and see if the symptoms persist. Something else you can do is apply ice to the part. So you apply ice again just to the outside of the knee with an ice pack for about 20 minutes, and I'd probably suggest you do that after you've done some training, and do it at least once a day. The other thing you can do is also stretch the ITB. There's a few different ways to stretch it, but probably an effective way is to put your affected leg, so for example the right leg, put that behind the left, keep the right leg straight. You can allow the left leg to bend. You turn away from the right leg, so you turn to the left, and then you're bending forward like this. Try and maintain your balance, and you should feel a stretch down the side of the leg and into the ITB. You could alternatively do this against a wall, so you put your right hip into the wall and you stretch that way. The other things you can do are also some massage, some gentle massage, or if you're familiar and confident using a myofascial roller, you could use that on the side of the ITB. down like this. So if this problem persists for a few weeks, even after trying these suggestions, it's possible that there are some biomechanical issues that you may have that's predisposed you to this. Now, ITB syndrome usually occurs as a result of weakness in the hip stabilising muscles, usually on the same side, and it could also be affected by overpronation of the foot. Okay, so any of those two things, which could be there together or in isolation, may be contributing or causing the iliotibial band problem to develop. It is a biomechanical problem, and it generally happens slowly, so usually there is a reason for the problem eventuating. It's best to get down to the reason for that problem and treat the cause rather than just the symptoms. So this is where we'd probably suggest you see a physiotherapist and get them to do a full, thorough assessment of your musculoskeletal system to determine where the problem is coming from. So at Northwest Physiotherapy Group, we've developed a screening tool that's appropriate for these sorts of conditions, and it helps us get to the cause of the problem. You can book an appointment or learn more information about this musculoskeletal assessment at our website, nwpg.com.au. We hope you've enjoyed the presentation, and we hope you remain in good musculoskeletal health. Thank you.